Good morning, everyone, or good afternoon, good evening. Thank you ever so much for joining this 20th Commonwealth China, and in fact, the last of the series before the Commonwealth Games, so very exciting. It seemed only appropriate that this webinar space would be taken with the topic transplant sport. And so we've got a selection of three specialists in this area to talk to you today on their experience in transplant sport. Like all of the other Commonwealth Tribute to Life webinars, we will have a panel discussion at the end of the session. So I'd really appreciate if you could send any of your questions either through the chat function at the bottom of the screen or via the question and answer function. So to start the webinar, I'd like to introduce James Newberger. So James's interest in transplantation started when he was a junior fellow working in King's College Hospital in London in 1975. And he's worked in the field ever since, initially with the Cambridge King's Transplant Programme and then in Birmingham. James has previously been Associate Medical Director for Organ Donation and Transplantation at NHS Blood and Transplant for 6 years and has a major research interest in transplantation. He was the editor of the journal Transplantation for 10 years and is currently chair of the Advisory Committee on the Safety of Blood, Tissues and Organs, a multi-professional group that advises all UK ministers on the safety of organs for transplantation. So welcome, James, and thank you for joining us.
Well, thank you, Laurie. Thank you, Dale, for the invitation. And we've got a three-part session today. We had it all working really well, and I can now see it. This is a joint venture, this Transplant Sport and Organ Donation. And Transplant Sport is a UK charity with three major goals. It's to encourage transplant recipients to lead active lifestyles. It's to raise awareness of the need of organ donation and to show appreciation for and remember the donors and their families. And when I say donors, I mean both living and deceased, and obviously donor families. A little bit about Transplant Sport. It was founded in '78 by Maurice Slapak, a surgeon who wanted to bring together patients and other transplant recipients and to held the first transplant games in Portsmouth. Since that time, the organization has grown and it's now chaired by Paul Harden. It organizes sports and social events for members to connect to each other. We encourage members to get fit and enjoy the benefits of their special gift. We use the games and other events to encourage people to the public to be aware of organ donation and share their experiences and show something which I think is not always emphasized enough, and that is the benefits that organ donation gives to family members. The British Transplant Games are held each year in cities across the UK, and you'll hear more about that. And we also support the World Transplant Games and the European Transplant and Dialysis Games. So outlined today is briefly, I'm going to talk a little bit about the academic side, if you will, of the benefit of sport and the importance of it. And then Yuri is going to, as you'll hear, will talk a lot more about the games. And then Holly will discuss how valuable the games are, not only to the participants, but as a vehicle to support organ donation. Now, the benefits of transplantation, I think, will be clear to all the audience. Cost saving for kidneys particularly, improved quality of life, improved length of life, and also benefits to both the living donor and the deceased donor families. So huge benefits, but it comes at a cost. Although life after transplantation is very, very good for most people, it's not normal. And this is just some data that we looked at for livers, and my interest is predominantly livers, so apologies for that. And this shows that although people live longer after transplant, they don't live as long as the normal healthy population. And in the dark blue bars are the anticipated survival after transplant, and this is for those who survive 6 months. So they got over the initial operation, and the light blue is the anticipated survival for age and sex match control. And as you can see, particularly for younger people, there's a significant gap between the anticipated life of a normal person and of a transplant recipient. So we've still got a long way to go to improve the length of life of these recipients. Furthermore, the quality of life after transplant, although is improved, is not normal. And this just shows some data on the left of SF36, where the green is the quality, and this is liver patients. The green is the quality, is the quality of life before transplant. The red is the quality of life after transplant, and the blue is the quality of life of the normal population. And as you can see, transplantation improves the quality of life, but still leaves a deficit, except perhaps in the mental area, the mental health areas. So the key message is that life after transplantation is very good, it's very much better, but it's still imperfect in terms of quality and quantity. And this is part of the function of the games to improve that deficit. Why do people die after transplant prematurely? Well, increasingly rarely because of graft failure, particularly for livers, and cardiovascular death is a major cause of premature death. So how does that relate into better outcomes? Well, there are a number of papers, and this is just one paper from Italy showing that people who were overweight were, after transplant, were more likely to die prematurely, and they also had better kidney function if they were more active. So again, transplant activity does seem to improve outcomes. That's supported by the renal advice that a healthy diet, a healthy weight management should be support, and there should be physical activity, at least, they're my words, at a level similar to the age match control. Alcohol consumption, recreational and so on is fine, but the important thing is that national guidelines recommend activity. And the same is true for liver disease. This is another recent publication that post-transplant exercise is beneficial, is associated with better quality of life, better engagement, and better outcomes. And the social interaction is also very important. And the final survey I just want to draw your attention to is a recent study, well, 4 years ago, where they looked at a relatively small number of solid organ transplant recipients, and they found that the reason for people doing more physical activity was a feeling of better health, motivation, social support, knowledge, and sometimes physicians recommending it. So they do feel benefit from health and mental as well as physical. It's worth just looking at the barriers, cost of fitness centers, although you can go for rapid walks relatively freely still. The side effects from medication were a problem, insufficient guidelines and feeling of less strength, various barriers, but all those are overcomable. So what I really wanted to just summarize is why transplant sport is so important, that life after transplant improves significantly in quality and quantity. Cardiovascular disease, though, is a major cause of premature death, and this is associated with lower physical activity and obesity, and increased activity post-transplant across all organs is associated with better survival, less weight gain, better outcome, and better well-being. So really, that's why transplant sport has its role in, as I say, not only the physical side, but the mental side. And I'm going to, you'll hear from others about the challenges and joys of organizing these games. And then Holly will describe how these are such a brilliant lever to increase organ donation, and they are effective. We have evidence that this is not anecdote, that they benefit. So that was a brief background, but I think more importantly, you'll want to hear from the other two colleagues, and I'll just put myself on mute for much to everybody's delight.
Not at all, James. Thanks ever so much for setting the scene for us there. Much appreciated. So now we'll move on to Yuri Matyshin. So Yuri has been heavily involved in sport since his time in Bradford, UK, and was the sport president for the Athletic Union during his time at Loughborough University, where aside from studying for his BSc in management science, he played football, basketball and cricket. His career in sport management has gone from strength to strength since then, and aside from creating the Sheffield based there, my words have gone. It's because there's two S's. Aside from creating the Sheffield Sharks basketball team, got there eventually, in 1994, of which he's now the chairman, Yuri is also the managing director of MLS Contracts, a sports consultancy and event management organisation that's been hugely successful in managing the British Transplant Games since 2005. So thanks for talking to us today, Yuri.
Thank you, everyone. I'm just going to share screen. Great. So thank you for the introduction, and James, thank you for setting the scene. As you say, physical activity is really important for us. And hopefully on screen you can see that the Transplant Games are coming to Leeds in Yorkshire in 2022, later this month, so very topical. And this will be the 44th Games under the transplant sport banner. So it's very much a flagship event, and you can see along the bottom various people who support our games. And these games are a financial challenge every year in that we have to raise all the money. There is no direct government support, though we do have support of NHSBT, which is very, very welcomed. And in the context of MLS, if we can put that into consideration, is that we have now been working with Transplant Sport as their event management people, if that's the word to say. So we deliver the events, and increasingly, in addition to this flagship event of Transplant Sport, we also are beginning to run a number of satellite and smaller events around the country to encourage people to start participating in sport before perhaps going to what's called a Games. It's our own mini Commonwealth Games, if that's the right word. And my fellow colleague John Timms is the Games event director, and I spend a lot of my time in raising the money for these games and creating long-term partnerships with funding and organizations to enable these games to have stability and affordability to the participants as they come. Then on the event itself, because of its scale, because it's around 2,500 people over 4 days coming to a city, we actually currently will have 6 people working on the project and 17 people for about 10 days at the project. So quite a big operation. And it just reminds me of the Commonwealth Games, which is about to happen in Birmingham. And obviously the fantastic status transplantation has within the Commonwealth Games this year in Birmingham. These are just some of the images from the games over the years, and it's very much a friendly games. People are participating. It's very much about a festival of sport. But to really understand what it's about, we've put together a simple video in a nutshell.
Well, it was a transplant surgeon, Maurice Slapak, and he wanted his patients to get fit after transplant. So that's the main purpose of the games when they started.
So it makes people aware in the general population that there are people that might well die from organ failure. And really, for those individuals in the longer term, the only and the best option is organ transplant, and that they can help to do something about it.
You know, most of the players here, most of the competitors would not be here if it wasn't for organ donation.
We all do it for our donors, and if it wasn't for them and their families who chose probably at the worst imaginable time to give their organs and save our lives, so I think we owe everything to them. So.
The reason why we're all here is because of our donors, and that just kind of lifts us up doing this for our donors. Like, we all want to obviously like do them proud and show the benefits of organ donation through these games.
All of these transplant athletes wouldn't be here without donor and a family saying yes. And so that's what we wanted to do, is help increase people chatting about donation, hopefully saving more lives.
And a lot of families aren't aware of the wishes of their loved ones. They often say no when asked would they donate their organs.
And 1 in 4 of our relatives don't comply. 25% of available organs not available to transplant. So they are the sort of conversations that we all need to have.
These events are superb for raising awareness in the public eye of how important organ donation is. But we all have that power, then we could help other people live.
A donor family, quite bluntly, is you join a club that no one ever wants to join. But once you're in it for life. And we support the Games fully. We work alongside recipients and charity to obviously promote organ and tissue donation.
When you see the holistic picture, that something good can come from something bad, it's well worthwhile.
Donor families go away knowing and having it reinforced that the decisions that they took were the right ones. And you see a little 4-year-old running along the track, there's a grin, and it's a grin of life.
Well, I hope you all saw and heard that video, and it was a kind of a way of putting it together as to what the games are about. And it is the annual flagship of transplant sport. It's where all the communities come together, and it's a very unusual. Sorry, my screen is moving without me even touching it. It is our flagship event, and it does promote the benefits of physical activity, but it's very much not about physical activity in the elite sense. It's more about participation in sport. And sorry, my screen, and I can't even control that. So what we are doing is having in Leeds in excess of 750 transplanted athletes coming along to the games. 120 in addition are live donors. And then on top of that, 1,300 participants are supporters and siblings of those participants in the games. And it creates a fantastic spirit and festival of sport. And all that activity develops into tremendous partnership and sponsorship opportunities. It's the highlight of the games is this wonderful donor run, where this is from Newcastle, where we went across the Tyne Bridge, where everybody runs together in participation of the games, creates a huge profile, which Holly Jones from Liquid PR will speak to you about next after me. But across the games, we're talking about 23 sports, multiple venues, stakeholders that involve the city, the NHS charitable trusts, universities and leisure trusts. And so it's quite a big undertaking to ensure that these games happen. And what it does do to many cities, it creates a massive direct impact back to the cities themselves. And it's something that we've used to leverage in bringing events to these cities. And many people find that the economic and social impact of these games are really, truly valuable, and something that we've been able to exploit. So in the games in Leeds, we're expecting up to 50 teams. Teams participate for their transplant units, and they come from the Aberdeen from Scotland to Southampton down at the coast. And we are truly inclusive in that they're from 3 years of age to 80 years of age. And we are working hard to ensure that we have equality and diversity in those games as well. So that a piece of our work over the last 2 or 3 games, obviously excluding the COVID pandemic, has been to try and make sure that we include more and more of our Southeast Asian communities and our Black African communities in the games and being involved in the games, be that from a volunteering or organizational aspect, as well as participating in the games. So it's a huge undertaking. It takes 2 years to organize, and we're doing this on a rolling program. And what we are able to do in a modest way is raise funds for the charity, but that's never the main obligation. The obligation is to create physical activity opportunities for people with transplants. This is the one place where donors, live donors, transplant recipients, physicians, clinicians, all come together in one location. And I would say it's probably the single biggest manifestation of transplant recipients promoting the benefits of transplantation outside of the one event called National Transplant Week in the UK. And if there's people from overseas, you may be aware of it. So it has a huge impact on our transplant community. It has a huge impact on their peer group mental health. They look forward to these games every year, coming together, being able to talk about their particular issues from all age groups. And it's something that they've greatly enjoyed and sadly missed in the last 2 years of the pandemic. But we continue through to Leeds in 2022, to Coventry in 2023, and hopefully Nottingham in 2024. And interestingly, later this year, we will also stage the European Transplant Games in Oxford. And in 2019, just prior to the pandemic, we staged the World Transplant Games in Newcastle and Gateshead. And those games were a great success, and we hope that the Europeans will be. And so a huge commitment by transplant sport to this physical activity and movement to create more active transplants. So for my last slide, I'm just going to play you this young man's interpretation and story about why he finds the games so important.
Hi, I'm Nathaniel and I'm 8 years old.
Nathaniel was born a little bit early, which was not too much of a problem, and we said he was small but perfectly formed. But little did we know that wasn't actually the case. It turned out that he had a problem with his bowels and also a problem with his liver. And the problem with his liver was called biliary atresia. They were able to make the diagnosis and do an operation when he was 7 weeks old to try and save the liver that he was born with. When he was 15 months old, he suddenly went into quite chronic liver failure and was urgently listed for a transplant.
And that is if your liver isn't working, you just have to go and get yourself cut open, and they have to take out your liver and then give you somebody else's. And that's what a liver transplant is. So, but it seems like a little thing, but it's actually a really big operation.
We were fortunate that a donor was found quite quickly, and he had the transplant and made an amazing recovery. He went from being quite lifeless and fragile to quite suddenly full of energy again, and you could really see the impact that the new liver had. So the Transplant Games is an opportunity for anyone of any age that's had a transplant of any kind to compete with other like-minded people.
In 2016 I did the long jump, 50-metre sprint, donor run. It's really good because if you feel that you don't like it, that you feel a bit different, that you've had a little operation, like a transplant, it helps because it kind of makes you realise how lucky you are to be able to come and do sport and survive your transplant.
Really delighted to be part of the Transplant Games because that's a really positive celebration of what's happened to him, and he can promote the requirement for people to be on the organ donor register to save little children like him. Because if a donor hadn't been found, you know, he wouldn't be here to tell his story today.
So hopefully you found that of interest, everyone, and gives you an insight into the Transplant Games and the scale of the event, which Transplant Sport have grown it. And we have ambitions to increase its size, but also to make sure that physical activities are year-round exercise, and that we do promote active transplants, and that the Games are something very much a pinnacle for everyone to look forward to and inspire more people to be more physically active. So that leaves me to lead in to Holly, but I'm sure Holly will be introduced first. Thank you, everyone.
Thanks so much for that, Yuri, and indeed that was inspirational. Thank you so much. So our third speaker today is Holly Jones. So Holly has 8 years agency experience and a master's degree in international public relations. She joined creative consultancy Liquid after working on a number of high-profile third sector and consumer clients, including Comic Relief, the National Trust, and Green Man Festival. At Liquid, Holly has led on activity for the British Transplant Games since 2018, and Holly was named as one of PR Week's 30 under 30 in 2020. So we very much look forward to your presentation, Holly.
Thank you.
Thank you.
I'm just going to try and share my screen now too. So as Laurie said, we've been working at Liquid on the Transplant Games, but also supporting transplant sport since 2018 to raise awareness of organ donation and staying active post-transplant. So I just wanted to take you through the last 4 years, I suppose, of Transplant Games and talk about the difference between messaging from when we started in 2018, but also having to go through a period of virtual games, supporting the transplant community through shielding. And now we're in the run-up to our first physical games since 2019, which is happening 2 weeks today. So if we just take a look at the timeline, so 2018 was the Birmingham Games. It was the biggest games to date, and was also the year that the changes in opt-out laws were announced. So we were already seeing a shift between encouraging people to sign up to the organ donor register to instead having to encourage them to share their wishes instead. 2019, as Yuri mentioned, was a bit of a bumper games year. So we had the British Games in Newport, and then we also had the World Games in Newcastle, of which we did a baton relay up the country to try and raise awareness in as many places as possible and get some spectators on the ground in Newcastle. In 2020, there was obviously a focus on COVID and shielding, keeping people safe, but also keeping morale up, keeping them happy, and keeping the transplant community leaning on each other for support. We were due to be in Coventry that year, but instead ran a virtual games. In 2021, we thought we were going to be all systems go. We were heading to Leeds, and then unfortunately, we had various other lockdowns and different variants. So we had another virtual games in 2021. And now we're 2 weeks out from the Leeds Games, as Yuri mentioned. And we also have the European Games taking place in Oxford in August. So I just wanted to go into each of those events in a little bit more detail and talk to you about how we secured media coverage and the kind of targeting and messaging that we did around that to try and get awareness spread as far as possible. So the 2018 Games was, as I said, the move to the opt-out rule. So we have always focused on case studies and focusing on sharing people's real stories, mostly in the cities that we are in. So in 2018, that was using both children and adults from Birmingham Children's Hospital and the QE Hospital here in Birmingham. And we take those stories and try and share them with the media to reach as many people as possible. We also ran a targeted social media campaign called It Takes Two. So this was the first time that we'd run a dedicated campaign on social, and it was all around trying to get people to sign up to the register, but actually letting them know that it doesn't take that long. It only takes 2 minutes. So we created a number of videos around that. One was on making a cup of tea, one was on how many baskets people could score in basketball in 2 minutes, brushing your teeth, that sort of thing. So videos that would appeal to everyone to kind of reaffirm that message that it only takes 2 minutes to sign up and you could be potentially saving lives. We had a really valuable partnership with the England and Wales Cricket Board, looking at targeting BAME audiences in particular. So we were in Edgbaston for the test match that year. We had children and adults from Birmingham do a guard of honour onto the pitch. And then we awarded some special awards to one family for organ donation there too, which got national televised coverage due to it being the test match, and also some targeted coverage in BAME titles as well, which was kind of the point of the activity. So that was a really big win. And then the opt-out announcement actually happened on the last day of the games, which was amazing for us. It meant that a health minister attended, as did all of the camera crews from across the UK. So we got widespread broadcast coverage on that day. And the health minister talked to a lot of different participants and covered a lot of the games. So that was a real opportunity to, talk about the laws changing, but show people what the games is all about. So some results from that year. So we had 44 pieces of broadcast coverage in the end. A lot of that was down to the law change. We got coverage on every major news channel there. And the coverage reached over 620 million people that year. The It Takes Two social media campaign garnered support from some celebrities. So we had video testimonials about how important it is to sign up to the register from the likes of Holly Willoughby, Philip Schofield and Alison Hammond. And social posts around that campaign had 1.2 million impressions. But most importantly, we were able to work with NHSBT on measuring how all of that affected sign-ups to the organ donor register. So we actually measured that there was a 7.2% increase in sign-ups between January and July that year in Birmingham alone. So that really shows the value of local on-the-ground media coverage. And there's just some highlights here as well. So we were on the sofa with Lorraine, a few front pages, the Daily Mirror, and also the Birmingham Mail there too. Andy Cole will come on to later, but he's been a really key figure in the last few years for us. So in 2019, it was the bumper games year in Newport and Newcastle. Again, we were focusing on case studies, but after seeing the value of broadcast coverage, we put a lot of our eggs into that basket, I suppose, and aimed on getting as much broadcast coverage as possible. And then we had the World Games. So to launch the World Games, there's a lady called Lisa Wilson, who I'm sure some of you will be familiar with, who created a commemorative baton in memory of her son, Tom, which she donated to Transplant Sport and is now passed over at the opening ceremony of the British Transplant Games. But that year, we also took the baton on a relay from London to Newcastle to mark the start of the World Games. And that allowed us to get some national coverage, which was obviously great, but also when we made pit stops in every city along the way, we were also able to get regional TV and newspapers there too. So targeting all the hyperlocal and regional people that can read something relevant to them as the baton passes through their town. We also had a focus on football. So we'd had the World Cup the year before, and this was the first year that football was being played at the Transplant Games. It hadn't previously been played due to potentially additional safety risks. But this was the first year that football was being played, and we got a lot of coverage out of that. And this is where Andy Cole comes in. So I don't know if anyone's familiar with his story, but he had a transplant, kidney transplant, and from his nephew, and struggled quite a lot mentally after that on dealing with the feeling of having a transplant and your body changing and all of that sort of stuff. So he previously didn't get involved with any sort of transplant sport, but we invited him to the World Games in Newcastle and he met the Team GB football team. It was an emotional day for everyone, but it kind of changed his perspective, and he has since been an advocate for organ donation and has done a lot of work on behalf of various kidney transplant charities. So he's been a really valuable key player there too. Some results from Newport and Newcastle. So 21 pieces of national coverage. and 27 pieces on the baton relay, including we started the relay from the sofa on Lorraine in London and finished it in Newcastle with BBC Breakfast. So it got a total campaign reach of over 3 billion. And we'd also managed to secure a BBC One documentary on the importance of staying active post-transplant. So they came to film at both games, so Newport and Newcastle, and that went out on BBC One the month after the World Games, and then was on iPlayer for a year as well. So that was a really massive win and really exciting opportunity for us. And there's some highlights there as well. So some sport features, which normally we aren't featured on sports pages. We're normally featured on lifestyle pages, but we managed to get onto the back page of the Daily Express, which was incredible. Lots there on Andy Cole, and some different, again, reaching different audiences, targeting younger people with packages on CBBC News Round, and the lovely Ella there at the top, who is a firm favourite on Good Morning Britain, but is now very passionate talking about the transplant games too. So she's become a real advocate for us too. 2020 and 2021, our focus shifted somewhat to keeping the transplant community united. So it's a scary time for those shielding. So we tried to keep morale up as much as possible. We ran 2 virtual games, and we managed to keep our donor run going. So for those not familiar with the games, we have a donor run on the Saturday evening every year, and that is the only event that anybody can take part in. You don't have to have had a transplant. And the whole point is to say thank you to donors and celebrate the gift of life. So we carried on encouraging people to do the donor run on their own or with family that they were allowed to see safely outdoors in those 2 years that we weren't able to stage the games. We managed to secure quite a lot of national broadcast interviews, sharing people's stories that had been shielding, but also it was important for us to put transplant recipients in for those interviews that had COVID and had recovered, because it was such a worry for people, especially lung transplant recipients, that COVID could be much more dangerous for them. So our focus was on, sharing the messages that obviously it is terrifying, but people have had it and recovered. We saw, as I'm sure everybody did, a shift to focus on social media. So it was a way for people to keep in contact. We started a number of challenges, so the virtual donor run, but we also started a campaign called Magic Moments. So we were unable to get to the game, so we asked people to share photos and memories of their favourite games of the past to keep them going until next year. We also partnered with our long-term supporter, Westfield Health, who created a series of exercise videos that people could follow at home to make sure they were staying active even if they were stuck in the house. We managed to, in 2021, stage a cycling sportive in Leeds. So that was with thanks to extra motorway services. We held races at Skelton Lake. And again, that was to encourage people to come along, get active, but safely outdoors on their own bike. And we also did a partnership with Yorkshire Cricket. So the picture just there on the right, we had some screens during the test matches. Unfortunately, there was no audiences there, but it was televised. So again, got widespread coverage too, which helped us tackle some of our issues around reaching BAME audiences. So the results of that, regional TV packages across the UK, again, when people spent time at home during lockdown, was when regional news viewing figures were at an all-time high. So it was a priority to kind of get packages, if we could, onto regional news programmes to get people thinking about what they could do while they're still stuck at home. We had an organic social reach of over 359,000. And we had 17 workout videos in the end made for us by Westfield Health, and 18 Magic Moments submissions. So we also had someone that did their own transplant games at home and did 20 sports in a weekend in their own garden. We had somebody that did a minute of exercise and putting it out on Facebook a day, which actually got participation from Ryan Giggs as well. So we made the most of what we had in those couple of years and managed to keep everybody together and generate excitement for 2022. So there's just some highlights there for 2020 and 2021. There's a piece on CBBC News Round, and we got covered on Sky News as well. And then 2022, we're on to Leeds. So it's 2 weeks today till the opening ceremony. We've actually found that having a 2-year break in physical games has meant that there's been renewed interest from media. We're also able to back anything that we're doing up with stats on organ donation figures and how they've been affected by lockdown. Again, there's been the change in messaging, so we are working closely with NHSBT on making sure that we're all on the same message of encouraging people to share their wishes rather than signing up to the register now. As a Games itself, we normally concentrate on the host city, but actually this year we've widened the reach and are working with Yorkshire organ donation groups. So this is a Games for Yorkshire rather than just a Games for Leeds. We've had some new partnerships for this year. So again, we're working closely with NHSBT, but we've also garnered a relationship with a company called Arc Media, who have provided us over £100,000 worth of free outdoor advertising. And we've actually seen billboards go live across the M1 in the run up to Leeds today. So those adverts will be going out across Yorkshire, and we'll be getting our games in front of as many people as possible and amplifying the message that it's not just a Games for Leeds and that people can come along and join in. And we're also building a lasting legacy. So we're creating a campaign that can be rolled out in cities to come. We're working with NHSBT on a special edition organ donor card for Yorkshire, which will be giving out from the day after the Games, but we'll be introducing that to everyone at the Games on the Sunday. We've got a lot of national media interest at the moment too, despite there was a few worries that our opening ceremony was on the same day as the Commonwealth Games, but actually that seemed to spur people on a little bit more, and it's made everyone want to celebrate with us. So yeah, we're very much looking forward to the Games and seeing what results we can get this year. So I will stop sharing. Thank you.
Fantastic. Thanks so much for that, Holly. We've had some really interesting presentations, and now we've actually got loads of really interesting questions coming through. So what I'll do then is I'll take some of them. I don't think we're going to have time for all of the questions, unfortunately, but I'll try and get through what we can. So one of the first questions, I think we'll take this one to James, is I understand that the Transplant Games is there to encourage sport and well-being, improve transplant outcome and promote organ transplantation. But can I ask if any thought is going into how expensive the Games are and how this can be made accessible to everyone after transplant cost-wise, especially with the cost of living rise?
Before I answer that, can I just sort of be a politician, or behave like a politician, I'm afraid, and say that one of the successes of all that you've heard from Yuri and from Holly is Transplant Sport's been extraordinarily lucky in its partnerships, particularly with MLS and with Liquid. They've both done so much to promote the Games and organ donation, and I just want to formally acknowledge that. I also want to acknowledge the close collaboration with NHS Blood and Transplant. We work very closely with them. We're independent of them, but we make sure that our marketing, our messaging, our leaflets are complementary to what they do. And again, that synergy is extremely important. And as this is going out Commonwealth-wise, I just really wanted to emphasize that it's partnerships that are so important. And the one I didn't mention is the Donor Family Network and the Donor Families. So there's a whole raft of other groups, particularly some of the smaller ethnic groups that we try and reach out to. But it's the partnership, and particularly NHSBT, MLS, and Liquid have been fantastic in working with us. And I want to say sorry for that. The point about the cost, I think we're all very much aware of that. We do try and raise as much money as we can, and particularly in these days, it's particularly hard. Westfield Health has been a terrific supporter financially over the years, and many other groups have also contributed, and you saw some of their acknowledgements in Yuri's slides. But yes, but these games are expensive to run, cost of facilities, although we try and play the embarrassment card and the romance card to show how good it is for them. And we do, thanks to your instincts, succeed up to a point. Things are expensive. The road closures, hire of venues, ensuring there's health and safety, there's medical support, nursing support. We get very good physiotherapist support. And all this and the administration, insurance now is another rising cost. So there are a lot of costs. We do try and contain them. And we are very much aware that attending the games for the registrants and their family is a cost. We try and keep it down as much as we can, and we'd love to be able to reduce it further.
Fantastic. And Yuri, you had something to say on that?
Yeah, just to colleagues who are on the listening to this, the cost of the games is about $500,000 before the athletes themselves pay for their own accommodation. And what we always try to do is pre-book that accommodation, reduce the cost of it, get university accommodation as well, to try and make sure that it's as affordable and as accessible as possible. And then on the other side, if you can only come for a day, then you can join and participate in the events on that particular day, and you don't have to come for all 4 days either. So we try to provide flexibility as well as as cheap as possible. And in terms of the participants' cost towards the games, it's about 20% of the total cost. So it's really driven down as much as we can, and we're always very mindful of how we can raise more money. But it's about as inexpensive an event as I've ever come across, and we've been involved in the delivery of many Paralympic sports and disability sports in the UK.
Thank you. And mentioning the Paralympics, actually, somebody did have a question about whether there had ever been any thought to linking with the Paralympics. Is that anything that's ever sort of come up before? Has it been tried?
I think my answer would be careful for what you wish for. And we are very much involved with the delivery of sports like goalball, boccia, para-table tennis, etc. I think these games are unique, completely unique. The nearest thing I've ever seen to these games is the Special Olympics, for people with hidden impairments, which has a huge backing from Coca-Cola and Sport England. And what we're trying to do is receive funding from either NHS Charities Together and or Sport England, because one of the issues around our group, we're not seen as a disability cohort. So we are not part of the disability model for sport in the UK, and therefore we can't access funding. And we're trying to become less invisible to the institutions of our country, to say we really are a group of people with long-term health conditions, and therefore we should receive support in increasing physical participation. We are slowly building that narrative with Sport England and other agencies, Sport Wales, Sport Scotland, and so on, to try and get more support for our participants.
And James, have you got some thoughts on that?
Thanks. Yes, I mean, it's a very interesting idea, but I think firstly, the sports are largely we focus on participation rather than winning. And secondly, it does give opportunities for transplant recipients and their families and the donor families to get together. And I think if we were to dilute that, you might lose that. But whether we should think of other possibilities of combining with disability, I think is a different option. But my initial response is to be cautious about diluting what we have at the moment. But maybe we can expand in other directions if that's not murdering metaphors too much.
Okay, So talking about expanding in different directions then. So obviously transplant sport is hugely successful in the UK, but how can we take that more broadly out across the Commonwealth, do you think?
I mean, you'd be interested to hear your and Holly's views, but my feeling is that we can say what we do. I don't think it's up for us to tell other countries what they can do. I think the model is very good. We do have our limitations. We do have our challenges still. There's a heck of a lot we can do to improve what we do. But I think if other countries, other organizations are interested in seeing what they can learn from us, adapt it and improve it, and equally, if other countries have ways that we can improve ourselves, we'd be grateful to hear it. So I think this is a great opportunity for us to learn from each other. And I would, as I say, for us, it works really well. It does give support to those participants and their families. It does raise organ donation awareness and registrations. So it is a very good model, and we'd be very happy to work with other countries to support them and learn from each other.
Absolutely. Holly, what were your thoughts on this?
I think from a media point of view, you know, it's actually landed at a really great time that our games are happening at the same time as the Commonwealth Games, because there'll be delegates here, well, here in Birmingham, but here in, you know, in the UK to watch the games and represent their country at the games. So if we can get as much widespread media coverage as possible, then we've got a better chance of reaching them while they're here. I think the European Transplant Games later in the year is another great opportunity for that, when we'll have delegates from all over the world, specifically from the organ donation community, that will be able to see, you know, how we put on events here in the UK and how we support that with media and how we support it medically. So I think it's a great year to kind of help that opportunity along.
Absolutely. And Yuri?
Just finally, over the years that we've held the games, we've had people visit the event and, you know, review and go back and think about whether they could host it or something like it. But we do work with Australia, and they do have biannual games. And in Europe, we're the largest transplant games, but many countries don't have a national event. They directly go to a European or world event. So those events are also quite about participation as well as competition. But the opportunity, as James has said, is for people to view the model that we have and try and replicate, or, you know, these things have to fit into your own funding structures. We're essentially a standalone operation. So it's build it up small and get bigger as you move through. But it could be replicated, and is, in Australia, America, Spain, amongst other countries.
I think we've got time for another question. So this one might be more for James. This is a bit more researchy. Patient-related experience or outcome measures are, you know, recognised as how we judge the success post-transplant in a lot of ways, and we've moved on from looking just at, you know, time to looking at quality of life, very much so after transplant. Where do you envisage transplant sports moving forward in this, and how can we do more to improve patient quality of life after transplant? Big question, sorry.
Yeah, and as you say, in my sort of clinical experience of transplant, looking after transplant recipients, the quality of life is very variable. Some of them do extremely well. I think we haven't focused enough on quality of life. I think the impression I get from transplant sport, the very strong impression, is that it does improve the quality of life of those who participate, but we haven't quantified that. There is somebody coming to the games in Leeds for the first time, Dr. Greg from Cambridge University, who will use the games, but I think we could do more to measure, if you like, the output. it's important, but for me, in a way, I think one of our biggest challenges we have is getting more clinicians to promote the games to their patients. And I mean, not just the transplant physicians and surgeons, but the nurses. We've had great support from physios, from OTs, pharmacists, and to get them to encourage people to attend, and then to focus down on the sort of minority groups where we need to get them involved in sport, but we also need to get them involved in organ donation discussions as well. And that doesn't really, I mean, it is an important area. We could do more. I think we could do more. How far of a priority it is at the moment, once the games get up and running again, then I think we should be looking at it. And it's a very fair question and point.
Thank you very much. So I think, oh, hang on. Yuri, did you have anything else to say on that one?
Sorry, I don't want to prolong it. Just one
thing.
No,
there's plenty of time.
One thing we are doing, James, is in partnership with Westfield Health, who are a huge health provider, not in the sense of Bupa Insurance, they do that as well, but Westfield Health have launched a fantastic health and well-being app. And in this app, we're building a presence for transplant sport and active transplants, where we can actually begin to put information, a repository of references and so on, so that people can be introduced to information about the attributes of being physically active, sleeping well, diet, nutrition, playing physically, and so on. And what we believe we will therefore reach more people who have had a transplant but are not physically active, because the word sport is off-putting. So this transition to the word active transplant is going to be an important one about reaching more and more people and the benefits of physical activity. It's actually the same issue in the generic population of the UK about getting people, if you tell them to go and start playing sport, as opposed to get off your couch to doing a 5K or a 3K walk or whatever, it's that same method of thinking. So trustees and Transplant Sport are looking into that through a partnership with Westfield Health and also Kidney Care UK.
I'd be interested to see sort of the developments we make on that, because it's true, isn't it? Is that people are if you haven't got a background in sport, if it's not something that you did a lot as a kid, then certainly coming to it as an adult, I think people are intimidated by the word sport, perhaps. And so it would be great to be able to kind of broaden people's participation, in that way. I think now I'm going to bring in Dale Gardner, if he's still on the call. Hello, there we are. Hi, Dale.
Thank you, Laurie. I think I'll just want to thank everyone. I won't be able to be at Leeds because I'm actually in Australia, so post-COVID heading home. So I'm sorry, everyone. But I think it's just going to be fantastic. And Holly put in the chat where we can sort of, I take it we can still sign up to attend, even though we can't register now to actually, because we're can't register as a transplant recipient or a donor family. Is there a difference?
Yeah, so you can still register to sign up to the donor run, which is the event that anyone can take part in. But there's also information on the Transplant Games website on the events that are happening and where they are, and people can come and see. So we start with an opening ceremony on the Thursday, which is in Millennium Square in Leeds. So anyone can come along and watch that, and it's always very emotional and amazing. We have an athlete parade, handing over of batons and lighting of flames. So yeah, the more the merrier to that in particular. So.
Well, I think we wish you all the very big success with this. It's so important for donor families and for transplant recipients in the UK and across the world and Commonwealth. And that's it. That's 20 webinars we have delivered since our launch of the Commonwealth Tribute to Life project on March the 14th, Commonwealth Day. And as of next Friday, not this one coming, but the one after, the 22nd of July, we will be hosting our inaugural ceremony at Edgbaston Cricket Ground in Birmingham, in which we will mark the start of a 5-year memorandum of understanding between Commonwealth nations to share knowledge and expertise, much as we did today, on organ and tissue donation and transplantation. So we will be streaming that on YouTube. It'll be an evening event. So you may want to watch it live, or you could over a few drinks, or you could watch it on catch up afterwards if you so wish. But it's going to be fantastic. There will be more webinars in the future. This was just, we wanted to really, within these two bookended events, the launch on the 14th of March of the project and the mark and the inaugural ceremony of the 5-year Memorandum of Understanding, we wanted these activities, and 20 webinars in these weeks has been absolutely fantastic. There is a wealth of world-class education there for us all to learn from, and I've learned enormous amounts. So thank you for everyone's support for today and also for the last weeks for this. And we look forward to the work to come, because really this is just starting on July 22nd. This is the start of working together across the Commonwealth. It is not the end. Thanks very much.